Hey guys, welcome to the anatomy of hip joint. So actually we are going to discuss about the anatomy of the hip joint in terms of two parts. In part 1 we will discuss about the type of the joint, the articular surfaces, the ligaments of the hip joint, about its stability and also about the relations of the hip joint as well as bursae surrounding the hip joint. And in part 2 video of this we are going to discuss about the blood supply of the hip joint, the nerve supply, and what are the movements that the hip joint is able to produce and what are the muscles that produce them, and finally we will have a small discussion about the clinical correlation related to the hip joint. So in this video we are going to discuss about the part 1. So stick to the video till the end. So we'll begin with the basic introduction to the hip joint. What we know about the hip joint? The hip joint is a ball and socket type of synovial joint, right? And this joint is between the head of the femur as well as the acetabulum of the hip joint. So basically you can call it as the largest ball and socket type of hip joint in the body. So what is the function of the hip joint? It actually supports the body weight during standing, and also it is able to transmit the weight of the upper body to the heads and necks of the femurs. So this is just a basic introduction to the hip joint. Now we will move on to the type of the joint. When it comes to type of the hip joint, it is actually synovial joint of ball and socket variety. Synovial joint of ball and socket variety. So this is the type of the hip joint. Now we'll move on to the next, which is the articular surfaces. So what about articular surfaces of the hip joint? Actually articular surfaces just means that between what are the two bones that this hip joint is made up of. So actually when it comes to the articular surfaces, this joint is between the head of the femur with the acetabulum of the hip bone. Acetabulum of the hip bone. So the articular surfaces are the head of the femur along with the acetabulum of the hip bone. So basically this is the hip bone, right? And this is the femur. You can call it like this. Okay, you are getting me right? So this is the hip bone and this is the head of the femur. It's greater trochanter, lesser trochanter and the trochanteric line. So the articular surfaces is the head of the femur, this portion along with the acetabular notch of the hip bone. So this is about the articular surface, and near the head of the femur we have something called as the pit. This pit is known as the fovea capitis. This pit is called as the fovea capitis and it has a ligament attachment known as the ligamentum teres. This ligamentum teres is different from the liver. We have discussed a separate anatomy of the liver. Please make sure to watch that. So on the head of the femur we have a small pit known as the fovea capitis, and this fovea capitis lodges a ligament which is known as the ligamentum teres. So when it comes to the articular surfaces, it is actually between the head of the femur to the acetabulum of the hip joint. So that is about the articular surfaces. Now we will move on to discuss about the ligaments of the hip joint. So coming to the ligaments of the hip joint. So when it comes to the ligaments of the hip joint, we have 7 different ligaments. And what are those ligaments? One is called as the capsular ligament. Capsular ligament. And then the second one is called as the iliofemoral ligament. Don't worry, we are going to discuss about all of these ligaments in detail. We have something called as the iliofemoral ligament. And then we have the pubofemoral ligament as well as the ischiofemoral ligament. Pubofemoral ligament. And then we also have ischiofemoral ligament. Ischiofemoral ligament. And the next ligament we are going to discuss about is about the transverse acetabular ligament. Transverse acetabular ligament. As well as the sixth ligament is called as the acetabular labrum. Acetabular labrum. And the seventh one is about the ligamentum teres. Ligamentum teres femoris. Basically this is also called as the round ligament of the head of the femur. So you are actually getting me right? So So what are the different ligaments of the hip joint? We have the capsular ligament, iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, the transverse acetabular ligament, acetabular labrum, as well as the ligamentum teres femoris. So these are the different ligaments that help in the stability of the hip joint. So when it comes to the capsular ligament, this capsular ligament is a strong and dense fibrous sac. It's strong as well as it is densely fibrotic. Dense fibrous sac, and it is nothing but it's a joint capsule which covers the hip joint, and you can call it as joint capsule, and it also has synovial membrane which lines the inner aspect of the fibrous capsule. It also has the synovial membrane which lines the inner aspect of the capsular joint, and this helps in the stability of the hip joint as well. So moving on to the next three ligaments. These are the iliofemoral, pubofemoral, and ischiofemoral. You remember the three parts of the hip bone, right? That is the ilium, pubis, as well as the ischium. And from these parts, the ligaments will arise and they will land on the femur bone. So from the ilium to the femur, we have the iliofemoral ligament. From the pubis to the femur, we have the pubofemoral ligament. And from the ischium to the femur, we have the ischiofemoral ligament. And these three ligaments, out of these three ligaments, we have the iliofemoral ligament, which is the strongest. So iliofemoral ligament is the strongest, and they help in the very much stability of the hip joint. These three ligaments play a major role in helping about the stability of the hip joint. So iliofemoral ligament is also called as the ligament of Bigelow. Ligament of Bigelow. So this is the Y-shaped ligament which attaches from the ilium to the femur. When it comes to the pubofemoral ligament, this is a triangular ligament. This is a triangular ligament, and it also helps in the stability of the hip joint. And when it comes to the ischiofemoral ligament, this is a relatively weak compared to the all of these ligaments. It is relatively weak, as well as it also helps in the formation of the hip joint. So this is about the three ligaments, that is the iliofemoral, pubofemoral, and as well as the ischiofemoral. And when moving on to the ligamentum teres femoris, when it comes to ligamentum teres femoris, it's also called as the round ligament of the head of the femur. It is called as the round ligament of head of the femur. So this attaches from this is called as the ligamentum teres, and it actually attaches from the head of the femur all the way up to the acetabular notch, and it also transmits some of the arteries to the head of the femur as well. So moving on to the acetabular labrum. Acetabular labrum is nothing but it's a fibrocartilaginous rim. It's a fibrocartilaginous rim which actually surrounds the acetabulum, of the hip joint, and it also, this labrum, it actually deepens the acetabulum to make sure that the hip joint is correctly stable, and it also grasps the head of the femur to hold it in position. So moving on to the transverse acetabular ligament, this is a part of the acetabular labrum. It's actually the part of the acetabular ligament. When you find that this is the acetabulum, right, and we have the ligamentum teres from the head of the femur all the way to the acetabulum, and this acetabular covering it is this ligament is called as the transverse acetabular ligament, and this helps in the stability of the hip joint as well. So this is about the ligaments of the hip joint. We have the capsular ligament, iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament. We have the transverse acetabular ligament, acetabular labrum, as well as the ligamentum teres femoris, and these all ligaments will help in the stability of the hip joint as well. Now moving on to the next discussion topic of the hip joint, that is we will discuss about the stability of the hip joint, what are its relations, as well as the bursae around the hip joint. So stick to the video till the end, and if you are new here, make sure to subscribe. So the next discussion topic is about the stability of the hip joint. In terms of the stability of the hip joint, we are going to discuss about what are the different structures that help in the stability of the hip joint. So this stability is firstly provided by the depth of the acetabulum and also about its narrow structure. It is provided by the depth of the acetabulum as well as its deepening by the acetabular labrum. We have the depth of the acetabulum as well as the acetabular labrum which deepens it still more, and this helps in the grasping of the head of the femur and it makes it stable. Moving on to the next one, we also have the three strong ligaments, right, which I just discussed. Three strong ligaments which are the iliofemoral, pubofemoral, as well as the ischiofemoral. We have the iliofemoral, pubofemoral, as well as the ischiofemoral ligaments, and these ligaments are three strong ligaments which help in the stability of the hip joint. The next the next surrounding structures we have the strength of the surrounding muscles, which include the gluteus medius. We have the glute medius, the maximus, the minimus. They all help in the stability of the hip joint as well. And also we have the length as well as the oblique structure, like this oblique structure of the femur. They also help in the stability of the hip joint. So when it comes to the stability, we have the depth of the acetabulum as well as the labrum. We also have the three strong ligaments, which are the iliofemoral, pivofemoral as well as the ischiofemoral ligaments. And also we have the gluteus medius, maximus and the minimus, and these structures help in its stability. And also we have the length of the femur as well as the obliquity of the femur, which helps in the stability of the hip joint as well. Now moving on to the bursae around the hip joint. Bursae. So when it comes to the bursae around the hip joint, we have 7 different bursae. We have 7 different bursae which are the bursae around the hip joint. What are those 7? We have 4 under the gluteus maximus. We have 4 bursae around the gluteus maximus, and we have 1 under the gluteus medius, 1 under the gluteus medius, and also we have 1 under the gluteus minimus. And finally the one more is remaining, right? This one we have it is under the psoas tendon. Psoas tendon. So we have 7 different bursae. The 4 bursae are under the gluteus maximus, one each are below the gluteus medius, gluteus minimus as well as the psoas tendon. So these are the 7 different bursae that are situated around the hip joint. Now moving on to finally the relations of the hip joint. So when it comes to the relations of the hip joint, we have the anterior relations, the posterior relations, and also we have the superior as well as the inferior relations. So what do we have? We have the anterior relations, posterior relations, superior as well as the inferior relations. So when it comes to the anterior relations, we have the femoral nerve, femoral artery as well as the femoral vein. Just remember the structures that I am going to tell you. Anteriorly, what do we have? We have the femoral nerve, femoral artery as well as femoral vein. Posteriorly, we have some of the muscles of the gluteal region, which are the piriformis, the obturator tendinous, superior as well as the inferior gemelli. We have the quadratus femoris as well as the gluteus maximus. So these are all the muscles of the gluteal region. They are related, posterior related to the hip joint. So when it comes to the superior relations of the hip joint, we have the reflected head of the rectus femoris as well as we have gluteus minimus, gluteus medius as well as the gluteus maximus muscles. They form the superior relations of the hip joint. When it comes to the inferior relations, we have the pectineus as well as the obturator externus. So these are the different relations of the hip joint. So thank you guys, thank you for watching video till the end. Please make sure to subscribe and hit the like button, and also you can share my work to your other friends and people who want to learn more about the anatomy. Thank you so much, and I'll see you in the next video. Bye.